Good afternoon. I'm Dr. Mitch Munson, the Secretary-Treasurer of the American Optometric Association, and I'm here in my own backyard of beautiful downtown Denver, where AOA is hosting its state legislative and third-party national conference, where we have over 300 attendees made up of optometrists, state executive directors, third-party chairs, state legislative chairs, students, faculty, lobbyists, and legislators, all here to learn about this once-in-a-lifetime historic game-changing event known as healthcare reform. Over the next 2 to 3 years, as this huge piece of healthcare legislation unfolds, I want you to know that the American Optometric Association is going to do everything it can to make sure that optometry is kept at the forefront of healthcare delivery and that you, our member, is kept at the front line of comprehensive eye and vision care for the public. What an AOA member is going to get is that information firsthand, hot off the press, and to help them navigate the waters of healthcare reform, whether it be how to get on insurance panels, what they should be billing and coding, how things are going to change for their own practice and their own employees. These are the things that we are committed to providing for our members. And I'll answer this from a personal standpoint because I've been an AOA member since day one, and no one ever had to really tell me or try and educate me about the value proposition of being an AOA member. It was intuitive for me, as it was for many of my colleagues 25 years ago when we graduated from optometry school. It's a little different day, and I think what I have learned being a member and being involved in organized optometry, I've seen the value even more firsthand as a state leader, as a regional leader, as a national leader. I completely understand now the value proposition that AOA provides, both in terms of advocacy for our members on both the state and federal level, and in terms of the benefits that we get, scope of practice, understanding what our scope of practice means, and moreover, understanding what our role is in the entire role of healthcare delivery in this country. There's a couple things I like. I think early on, it was being able to help people, and still to this day, having people see better. I don't think there's a sense that we have that is as precious as our vision, and helping someone to see better is certainly a great fringe benefit for us personally as optometrists. But I think for me now, after being in practice for 25 years or so, what I enjoy most are the personal relationships that we have with our patients. I don't think there are too many healthcare professions that cover the gamut of demographics that we do in our practice, cradle to grave care. And to me, seeing multiple generations in the same family is just a great privilege and a pleasure for me personally.